Hello, everybody. It's Dr. Eric Balcavage, and we are back for another edition of the Thyroid Answers Podcast. With me, as always, is Dr. Erica Riggleman. Good morning, Dr. Riggleman.
Good morning.
How are you? It seems like we've been a long time since we've done a podcast.
I know it's been a while. Life gets hectic.
We've both been busy doing different things. And it's one of the reasons we're going to talk about our topic today is we both, in the last year, have integrated our practices and introduced or brought stem cell therapy to our practices to help our patients, and we're seeing phenomenal results with our patients. And so it's our topic for today, but it has created a little bit more busyness in life, right? Helping to educate the public on what stem cell therapy is. And I know I just came back from Austin, Texas, where I had to discuss and teach on detoxification and detoxification 2.5 with our friend, Dr. Kelly Halderman. And she was on the podcast just a couple episodes ago, right?
Yeah.
So I think we got to get back on track here. We'll get a little bit more podcasts out for our guests. And I know we definitely need to do another Q&A because I have a bunch of questions that from people that I know we got to put out there.
Mm-hmm.
And we'll get those done in the next couple of weeks. We'll get some more guests on. So today it's all about stem cell therapy. So why don't you tell people what is stem cell therapy?
Well, it's a fairly new and a growing field, essentially, in the medicine realm, because what stem cells are, I mean, we all have stem cells, and what a stem cell truly is it's kind of like a blank cell that's going to differentiate into different tissues. It's really how we repair, regenerate, and regrow tissue throughout our lifetime. And so when we're looking at a stem cell, we all make them. It's really, they do three things in the body. They're going to reduce inflammation, they're going to modulate the immune system, and they're going to regenerate, repair, and regrow tissue that's been damaged. And so it's really that healing process. And the problem with, stem cells is that the older you get, you just start to lose the amount that you get. And that's really where aging comes in. And so, you have these blank cells that really are responsible for the healing process, which makes it really, really important when somebody has inflammation or they want, even if you just have a paper cut, it requires stem cells to come in and help to repair that tissue.
Right. So stem cells are the regenerative cells of the body, right? And everybody has them. As you said, they live dormantly on your blood vessels, right?
Yep.
So in an inactive state. And I think the way I try and explain that to our patients is that the stem cells are like firemen, right? They're hanging out at the firehouse. They're just cooking, lifting weights, playing games, sleeping, whatever. And then when there's tissue damage, damaged tissues release inflammation. And inflammation is not good. It's not bad. It's actually both, right? It's actually good and bad. So in an acute stage, it's really good. Inflammation is then the fire alarm that kind of signals to the body that, hey, I'm damaged, come help me. So important, inflammation's good. And anytime I do a talk, people, when I ask, is inflammation good or bad? Everybody says bad, but really it's a critical part of healing.
Oh, absolutely.
And so when the inflammation occurs, it's like the fire alarm. It activates your stem cells. So it wakes up the stem cells in that area, activates them, and attracts them to the area of tissue damage. And it's like the firemen. They get activated, the alarm goes off, they get dressed, they put their stuff on, they get in the fire trucks, and they head off to the area of tissue damage. So inflammation is critical to the healing process. Once those stem cells get to that area, as you said, they do three things. They're anti-inflammatory, they're immune modulating. We probably should touch on that a little bit more. And they help support regeneration of tissues. Now, your cells, as Dr. Erica said, you've had them your whole life. The problem is, as you get older, the quantity and quality of your stem cells age. They age right along with you. And it's a massive drop-off in the number of these, what we call the mesenchymal stem cells, with age and time. So we probably should kind of discuss those factors. And the first one is the inflammatory component. So as we said, inflammation's good. When it's in acute stage, it becomes problematic when it's in a chronic stage.
I think
right?
You often, in your educational process, you always explain it as a controlled burn versus a wildfire that's way out of control.
Absolutely, yeah. So if I'm burning the yard trash in my yard, it's, you burn all the leaves, the sticks, all that stuff. It's good for the soil. It helps fertilize the soil, puts minerals and all those nutrients back in. But if that catches my house on fire, my neighbor's house on fire, the forest on fire, now we've got a lot more destruction going on. So that is the big, if we think about it, almost every healthcare problem in this country is the result of chronic inflammation that's just getting out of control.
Yeah.
And it's that simple. It really does come down to that kind of simple thought process.
It is. And often people, they'll say, well, this just, it seems too good to be true. It seems too simple that stem cells can help so many different things. But, at the root cause of just about every condition or even problem is that inflammation. So if you can give the body resources that it needs to be able to fight that fire, then you're going to be successful at helping those conditions, because that's just what the body needs.
Yeah. And I tell people, listen, how do you know if you have a chronic inflammatory condition? It's the things you're taking your medications for. It's the reason you have symptoms, is you have chronic inflammation. And the reason, and we should say that chronic inflammation causes all these degenerative conditions: cardiovascular disease, high blood pressure, diabetes, neuropathy. It's all caused by chronic inflammation. Mm-hmm. And when you're young, you have lots of young, healthy, functional stem cells. And that's why 4 and 5-year-olds are not the people we see running around with degenerative arthritis, cardiovascular disease, and, peripheral neuropathy, and all these chronic degenerative conditions. Now, there's an outlier here and there, but the vast majority of people that we see with these degenerative conditions are typically older, right? And it's because there's a significant drop off in the quantity and the quality of our stem cells as we get older. And there doesn't have to be, right? But chronic inflammation, the load that we talk about many times, the stress load, increases inflammation. And as that inflammation load increases with time, and our stem cells are decreasing with time, there's a point where the inflammatory load just overwhelms what our stem cells can do. They're still working, they're still there, but the tissue that comes back in is not the same quality anymore. Yeah. And so instead of regenerating, we're repairing. And we'll talk about, I think we should probably talk about those things, because that goes along with this immune modulatory part.
I always give the analogy, it's kind of like a bank account. You have all these stem cells, and as you go through life, you make withdrawals. You have a surgery, you take a medication, you have a fall, you have something that happens, and you just make withdrawals. And the more issues you have over time, the more deficient you're going to become, which means you're going to deteriorate, which means some people start out with way more stem cells, which means they can beat up their body and, they may never develop a problem. But then you take somebody else who's, develops all of these issues. They maybe started with a lower amount, or maybe the stem cells that they have just aren't working. I mean, I've seen kids as young as 6 to 15 where their stem cell, they're not optimal. They're not working the way that they should. And so at the end of the day, it really does come down to the quantity of the stem cells that you have, but also the quality of the ones that you have. Because again, if you're not regenerating healthy tissue, you're going to develop problems just like somebody who didn't have the stem cells in the first place. Right.
So let's touch, there's a lot of things now that we're starting to talk, and I love that analogy of the bank account, because I think that's huge. And I tell people, most people know when they start to get the idea when the inflammatory load overwhelms what the stem cells can control. And in a lecture or talk, I'll always ask, what do we call that? And everybody's trying to think of this technical thing, and I'm like, we call it 40, right? We call that over the hill. Like, you get up, when you're young, you can beat yourself up. You can work all day, you can be outside doing activities, you go bike riding, you go drink a bunch of beer and alcohol with your friends, you go to bed at 2, you get up at 6, you go to work, it's like nothing happened, you bounce out of bed. And then somewhere in your 40s, you wake up out of bed, or maybe even younger for some people, you get up and you're like, oh my gosh, you don't have that recovery. And that's a good indication that when the simple things you used to be able to do and get up the next morning and bounce out of bed, you can't do those things anymore. That's a good sign that stem cell system is being stressed. So there's one thing I want to talk about, and that is, so people know, when we talk about the immune modulatory properties of stem cells, we talked that they're anti-inflammatory, which is a good thing. We don't want to suppress inflammation constantly with anti-inflammatories and antioxidants. What we want to do is allow acute inflammation, and then our stem cells should calm that down, okay? But then there's this, we talk about this immune modulating component. There's a couple things we want to talk about. And it becomes really important with thyroid patients and patients with immune and autoimmune conditions as well. So when we talk about immune modulating, that means the stem cells can modulate or calm the immune system to kind of reduce the autoimmune attack, the excessive immune response. But there's two parts to the immune response. There's the repair mechanism. So when tissue is damaged, the phase one is the repair phase, right? And so the cells and the tissues, the body's got this innate immune system that's coming in to do the repair process. And that part, we have damage, repair, and then regeneration. And so where sometimes people have problems is they get stuck in repair. And so if the stem cell system's not really healthy, instead of damaging a tissue and replacing that tissue with a brand new form of that tissue gets repaired versus replaced or regenerated. And that's huge, because if you have an injury and you want to replace the tissue, what you want to replace it with is a brand new, healthy, flexible, pliable tissue. But if you don't get to regenerate because your stem cell system's not healthy enough, you get stuck in the repair mode, which is a lot of fibrosis and scar tissue. And so people will always, the body's always fighting to work its way through that process. But when you're not as healthy, you have a tendency to have more repair. It's like putting duct tape on stuff. It still works, but it's not as good. What the stem cells should help us do is calm that inflammation, stop that repair mechanism, and start to regenerate, right? Rebuild a brand new tissue, not just put duct tape on things and say that's going to be good enough. Because if we're only in repair mode all the time, then we see lesser function of tissues, things aren't as flexible, we have this stiffness and tightness of joints, or we have things like that phase one of healing, that repair phase, is really associated with the innate immune response and things like histamine. So we can be stuck in kind of a higher histamine state if we're always in repair mode. Does that make sense?
Yeah.
You agree with that?
I totally agree. And you'll often see, patients who go through stem cell therapy, sometimes there's a period of time where they feel like they're getting worse. And it's really not that they're getting worse. It's that they're actually allowing what the repair mechanism to actually be efficient in what it should have been for the last how many years. And they're just not used to that. So when the immune system's trying to get balanced out, sometimes they're going to feel that instead of just patching it. Sometimes you have to, rip down a wall and actually rebuild it. And you feel that sometimes when your body is actually going through a full healing phase.
Yeah, and I would definitely agree with that. You've got somebody. So what Dr. Eric is saying is, if you've been unhealthy, your stem cell system's not as healthy, you've been in repair mode and patch and fibrotic mode, you have this autoimmune condition going on that's constantly breaking tissue down. The process of putting healthy young cells into the system can get in there, and one of the things that stem cell system is going to do is start to break down that fibrotic tissue. And that doesn't always feel good. That can stimulate a little bit of that immune inflammatory response because it's breaking up all that scar tissue. So that isn't necessarily unusual. One of the other things I think we probably want to discuss is maybe aging versus degenerating, or regenerating versus degenerating, right? So most people associate getting older, aging, right, with degenerating, and that they're the same things. You just get old and you degenerate. What's your thought on that?
Well, I don't think it's not correlated to a number, because you can obviously take 3 or 4 different people of the same age and their different levels of deterioration across the board. You can take one 80-year-old who may be completely active and doing lots of stuff, and another 80-year-old who's in a nursing home bedbound. And so I think age is a number, but I think it comes down to the amount of stem cells you actually have. That's the reason we age, is lacking stem cells. When the degeneration starts to outweigh the regeneration, so the breakdown becomes more than the rebuild process, that's where aging occurs. And so again, it comes down to that bank account analogy, is that, you know, if you run out of stem cells quicker than somebody else of your same age, you're going to age a whole lot faster. You know, that's how it's going to go. So it does, you know, there's kind of two avenues to that. Did you have less to begin with, or did you beat yourself up a little bit more than other people? And that's where the aging process kind of takes hold. And again, once you become in kind of that negative bank account where you don't have enough stem cells to recover from, you know, you slipping on the ice, or, you know, maybe eating really inflammatory foods, you know, that comes down to it where you're not able to replace the cells that you need. So you start to age.
Right. Yeah. And I think when I talk to people, you know, aging is that process of getting older, right? How well you get older. Some do it really, really nicely, and they seem youthful, right? And there's people that aging process is not so great. They seem to get older much faster, right? And degeneration is the loss of function of tissue. We talked about regeneration is the renewal, the rebuild of tissue. Degeneration is the breakdown. So yeah, it is. So we do associate getting older with tissue starting to break down. That to some degree is inevitable, right? But they're not necessarily the same things, because we see people that are 60, 70, 80, 90 years old that are really healthy, very youthful. They look fantastic. They're not on blood pressure medications. They're not on statins. They have very little arthritis. They're very active. And so they're 90 or they're 80, right? And so it's not necessarily that as you get older, you just degenerate, right? Or you have the same level, everybody has the same level of degeneration, as you said. And unfortunately, we see people with degenerative conditions, these kind of breakdown conditions like peripheral neuropathy and diabetes and cardiovascular disease and arthritis at younger and younger ages, at 40 and 30 and 20. I mean, we see people with chronic immune, inflammatory, and autoimmune conditions at earlier and earlier ages, which means they're degenerating, they're breaking down faster. And so I tell people, how do you know that aging and degenerating aren't the same thing, and that we don't all age the same? I just tell them, go to Facebook, right? When you go to Facebook and you look at your high school classmates, right, there's two thoughts that go through everybody's brain. And the first one is, dang, how they looking so good, right? And the other one is, dang, what happened to them? Oh my gosh, what happened? Because those people look like they just age so much faster than you do. And everybody who graduated with me is 51, right? And so we all are the same years old, but that process of getting older, some of us do a better job than others do. And it comes down to what you said. How many withdrawals did you take from the bank account? Mm-hmm. And so how many times did you have, what's the stress load? And that we probably should touch on that. Stress creates inflammation. And we talk about this all the time. And it's not just that one stress creates a problem, but it's the load. How much stress is accumulating on the system? And when you put enough stress on the system, that stress can activate what we always talk about, that cell danger response. When you activate the danger response, then we create inflammation. And again, inflammation is not bad. It's good. It's part of the healing process. But if that load or that stressors continue or accumulate, then we wind up with chronic stress and inflammation. And we're constantly activating our stem cell system to come help fix, repair, regenerate. And those are the withdrawals that you're talking about. How many of those have you had through your life? You may have started out maybe not as a higher bank account, right? Some people are really wealthy, start out with really nice accounts, some people not so wealthy. And then what did you do? How many withdrawals have you taken through that bank account through your life? And is it constant and continual? And that's what really starts to speed up the aging of your stem cell system, right?
I think that's a really important concept to understand, is that, you know, now that we can do stem cell therapy in this country, you know, we're making a deposit into that bank account. But just because you put that deposit in that bank account, if you don't address all the things that are making withdrawals from that bank account, you know, in a period of time, you're going to be back to zero again. You know, so you have to look at those underlying things, the stressors in the life. So yeah, it's amazing that we can give somebody a surplus of stem cells in their body, but then if you don't work on the things that are withdrawing them or using them up, you know, you're going to be in the same boat down the road. So I think stem cell therapy is part of a healing process, but it's not the cure all. It's not the fountain of youth. It's it's not any of that, but it's a tool that can be used to help the healing process. But then you still, on the back end, you really have to address all those things that destroy or use up your stem cells throughout your lifetime. So, it's when I see patients come in, they're hoping that this is the thing that they've been looking for, but I have to, let them know, like, look, the same thing that caused you to not have stem cells at this point in your life, we have to work on. And if we don't, you're constantly going to have to keep, depositing stem cells into your bank account so that you can continue, withdrawing from them. And so it's really important to understand that this is a part of the process, but it's not the only part of the process.
Yeah. And I think that analogy is huge, the deposit versus the withdrawal, right? Mm-hmm. So I'm going to kind of try and get us kind of organized here a little bit, because I think we're okay. But I want to talk about, when we talk about stem cell therapy, mm-hmm. what would be, when we do stem cell therapy for somebody, let's talk about somebody who's got arthritic conditions versus autoimmune conditions. Somebody comes to your office, they've got a chronic immune inflammatory thyroid issue going on, plus a bunch of other things. How do you determine if somebody is a candidate for stem cell therapy? And so let's just take it that way. How do you determine if somebody's a candidate?
Well, first and foremost, full disclosure, we both, provide stem cell therapy in our office, but we're not, we're fully medically integrated. So we're not the one actually performing the procedure. So, I think that's really important to understand, is that that's not, we're not actually providing the stem cell therapy, but we have a whole medical team that actually can do that. So when a patient comes into the office, we're looking at those things, evaluating, the degeneration process. I'm looking, when I'm evaluating a patient, the first and foremost, I want to see, one is their inflammation. So I think we're looking for that underlying inflammatory cause. We know that obviously stem cells, like we've talked about, do three things. They reduce inflammation, they regenerate and regrow tissue, and they modulate the immune system. So, who would benefit from stem cell therapy is, any person who has arthritis. We know that there's one, inflammation and deterioration. If you have an autoimmune disease, since stem cells modulate the immune system, that could be a huge component of trying to get the immune system balanced again. And then if somebody's just chronically inflamed, they have tendinitis, they have arthritis, all of those itises, those conditions means that there's some sort of systemic inflammation going on. And so those are the people that can benefit the most from stem cell therapy, because they have inflammation at the root cause of a lot of their problems that they've got going on.
Yeah, I would say the person who comes into your office who's struggling with chronic inflammatory, immune, autoimmune, or degenerative conditions is a potential candidate for stem cell therapy. And it's important that we talk about this, is that when we're providing stem cell therapy for somebody, we're not treating a condition or disorder. The main focus, and what I tell my patients is, the main focus is what we're trying to do is calm the inflammatory cascade, right? That's the biggie, the number one thing, because what you're struggling with is chronic immune inflammatory conditions. If we can modulate the immune system, break up some of the scar tissue, calm the autoimmune cascade, that's a huge plus. And then potentially stimulate the cells to help you regenerate tissue. And that's variable for everybody, because everybody's in a different state of degeneration and breakdown. And that's a process that can take a little bit longer. But where I see the stem cells really shine is that their anti-inflammatory effect. And that's the huge piece. So I see anybody who's got a chronic inflammatory condition is potentially a good person to get stem cell therapy, could potentially benefit from it. In some areas of the country, and regenerative medicine is huge, where there's just people trying to maintain their youth by getting stem cell infusions to maintain it. So we talk about people with chronic arthritis, people with degenerative joints, people with tendinitis, fibromyalgia, immune, autoimmune conditions, COPD, peripheral neuropathy. We're not necessarily treating those disorders. What we're using is the stem cells to help calm the immune inflammatory cascade, right?
Yeah, you're giving somebody a resource that they're lacking. It's kind of like a vitamin. You know, if you're deficient in B vitamins and you give that to somebody, it's a resource. Your body will then take it and do what it needs to do with it because it's been lacking it. Stem cells are no different. You know, we're just giving you something that's natural that your body can use as a resource. And I think that, you know, when you, just like a vitamin, if you're deficient in a vitamin, by taking it, you may see a response in the body because again, it needs that. You're giving it something that it's lacking. And again, it's not treating a condition. It's just giving you resources that your body truly wants and can utilize to start to jumpstart that repair mechanism.
Yeah, I think the analogy we can go back to is essentially you're draining your bank account with all these inflammatory issues, these stressors that aren't getting addressed, whether it's bacteria, virus, chronic toxicity, medication load, lack of sleep. All those things create stress that creates the inflammation that results in the degeneration, that results in the turnover and the aging of your stem cell system. And what we're doing here is just providing another deposit into the bank account. And the issue is, if you don't address the withdrawal process, if we put money into the account, but you're constantly withdrawing from that account, it's not going to last too long, which is another thing I want we can talk about is, sometimes people think there's two, I think, misperceptions. One is that when you get stem cells injected into a joint or a tissue, or you get an infusion, that those stem cells become you. And we know that they don't, right? So we can talk about that. They release growth factors that help our tissues. And then the other thing I hear people say, and I just heard this the other day, somebody who had stem cell therapy done in another office, they were frustrated because it's 5 or 6 years later, they fell, they re-injured their knee, and now they have knee pain, and they say, well, the stem cell therapy didn't work. So some people think that stem cells, once you put them into the body, are going to last forever. And that is not the case. And that helps us with this deposit withdrawal analogy, right? So if you put them in, but you're always in withdrawal mode, then they're not going to last forever. So you want to touch on the stem cells and how long they can last in the body. Do you want to talk about that?
Yeah, I mean, essentially, stem cells, how I'll explain it to patients is that they almost have like a built-in safety mechanism. Essentially, they're going to replicate about 65 generations. And so once they've gotten through that 65 generations, they're kind of done with at that point. And so, you know, when they divide, obviously they're 1 becomes 2, 2 becomes 4, and they're going to replicate. So over a course of a time, obviously the stem cells can create a lot of other stem cells, but those are really going to divide 65 times, which in our offices, we use umbilical cord stem cells. They're going to replicate essentially every, 24 hours, where 1 cell becomes 2. So that really translates to about a 3-month period of time where those stem cells are going to be regenerating. Now, it doesn't mean that people can't see results past 3 months, but it just means that that's really the stem cells are going to regenerate. It's almost like a built-in safety mechanism. And your own stem cells that we all have that safety mechanism. It just depends on how fast your stem cells replicate, because the older you get, the longer it takes for 1 cell to become 2. It can almost double or triple as compared to an umbilical cord stem cell.
Yeah. So when we're talking about time in the cell, as Dr. Erica said, cells have a life cycle, 65 cycles, and they die. So if we give you stem cells from a donor, or you take them from yourself, they go into the body, they replicate potentially 65 times, and then they're done. They're just like we get to a certain stage where we're old and we die. Your stem cells get old, die, and the body gets rid of them. So they all have a life cycle. They don't last forever, but the benefits can last for a long period of time, because those donated stem cells can last in your body about a year max before they may be fully pushed out, because the stem cells, as Dr. Erica said, they divide and divide and divide and divide, and the ones they produce divide and divide and divide and divide. So we can get, what the research shows is it takes about a year plus or minus, depending on the person, depending about a upon how much activation of those stem cells occurs for those stem cells are finally pushed out of the body.
Mm-hmm. I mean, I know I've seen patients, almost, a year out, and they're saying, I'm still seeing results through 8, 9, 10 months. I'm still seeing improvements. And so, I mean, the reality is in some patients, they may not even notice a difference from stem cells until 6 months after they've gotten it done. And, in our society, we're wanting it now type of thing. And you have to take a step back and say, this is a process. You have to allow these cells to start replicating, and sometimes it just takes the body a little bit longer to do this process, essentially.
Yeah. And it all depends on where you start from, right?
Mm-hmm.
So everybody starts from different points. So how much fibrosis, how much inflammation, how much work these cells have to do could be different for everybody. Some people, if you had a small little fire in the corner of your home, that's not going to take potentially as much work. But if you have an apartment building that's fully engaged in fire, you could have firemen throwing water on that for hours and not really seeming to make a dent. So it is different for everybody, and it's hard to judge. Sometimes the people who are the healthiest still take longer to heal and repair. Sometimes some of the sickest people see the fastest change in results. It's just hard to predict from person to person. But the other point we want to cover on that is when you take cells and donate them to somebody, even if you take your own cells out of the body and put them back in, the cells that we give somebody don't become the new tissue. They release growth factors that help your cells and your tissues rebuild, regenerate. Okay. So originally we thought that we put cells in, they become the new tissue, but that's not really what happens. Really what happens, they just keep releasing the growth factors to stimulate your own tissues. And one of the really cool things that can be really beneficial is that young stem cells, and we're going to talk about the difference. I'm going to have Dr. Erica talk about the difference between the different types of stem cells. But young stem cells have this unique ability to make your older stem cells younger. So a stem cell, when it goes into the system, it can go up to a cell, and if the cell is dying, it'll leave it alone. It'll say it's too far gone. It can go up to a healthy cell and find out that that cell is healthy and doesn't need support, leave it alone. And then it can find a cell that's sick and actually help rebuild or regenerate and reactivate that cell. And that's any cell, but it's also your own stem cells. So it can make your stem cells more youthful. So even the cells that we donate or that we deposit, right, they're only going to last a certain period of time, but it can make your stem cells more youthful, more functional. So I guess we could say by providing a deposit, it makes your bank account go up, not just because of the deposit, but because now we've gained more interest on that bank account, right? So it makes your stem cells more youthful, makes it more younger. So that way, even though the cells that we provide may be gone in about a year's period of time, your stem cell system and you're healthy, you're healthier, so you may be able to heal and repair and regenerate better later, even though those stem cells may have done their initial job. The benefits of those things can last for years.
Yeah, I think that's a really interesting component that goes along with stem cell therapy, because one of the biggest things I'll have when patients come back in after receiving stem cell therapy, they'll say, well, my joints still hurt, or I'm still dealing with this, but they'll say, well, the one thing I have noticed is I have more energy. And, when you're taking a sick mitochondria, like your own stem cell, where it's just not working the way that it is. And let's say, because studies show that it donates mitochondria to sick cells as well. So you can, that powerhouse, if you have a healthier mitochondria, we know that that's, part of another reason why we age is unhealthy mitochondria. So if your powerhouse works more efficiently, you're going to use less energy. It's almost like a cleaner energy. You'll have less byproducts that your body has to deal with. You're going to have more energy to do other things, and that down the road, could make you more active or more motivated. And it kind of just pushes you down this wellness pathway. And so, overall, there's so many things that can be beneficial from stem cell therapy, but, just having more energy, a lot of our sick thyroid patients, they would love to just have more energy. That's key, is that yes, you can regenerate, repair, reduce inflammation, but if you have more energy to be able to, put into, okay, taking my supplements or getting a little bit of exercise or being more motivated, I think that's key to overall health and wellness.
Right. So here's what I want. When we talk about stem cells, both of our offices, we've decided that we really like the allogenic cells, donor cells. Mm-hmm. So what I want you to do is, if you don't mind, is discuss the difference between what was done previously, what we call autologous stem cells, mm-hmm. and what we are doing in our office, which is allogenic stem cells, and the type of stem cells we're using.
So the big thing is, obviously, when we're doing the autologous is going to be from yourself. So, traditionally, for many, many years, people have been taking their own stem cells from either bone marrow or fat and taking them out. And a lot of these are orthopedists that are doing this because it involves, surgery. And then they're giving them back to that same person. When we're talking about a donor or, donor stem cells, they can, come from a couple different sources, but mainly it's going to be the umbilical cord is where, most people, it can come also from the amniotic sac. And so those are donated tissues, essentially. We don't have to worry about, from the donor perspective, a lot of people will say, well, they're not my own. Will I reject them? And so at the end of the day, these essentially are blank cells. Your body doesn't know the difference between your own stem cells and these. I always give the analogy that the umbilical cord, those cells are passing between the baby and the mother. So they can't have the immune system attached to it, or else somebody is going to be creating an immune response against them. So they fly underneath the radar of the immune system, which is why there's no compatibility. You don't have to blood type it, none of this stuff, because at the end of the day, they're just a blank cell essentially. And so there's benefits to both sides. Do they both work? Absolutely. And so, but it comes down to what you've got going on that would weigh out a little bit more of which side you should go with. You have to think about, from taking your own perspective, when they take stem cells out of your body and put them back into you, those cells are as old as you are. And so if your own stem cells aren't enough right now to be able to produce regeneration and you're having issues, why would you take something out that's already not working and try to put it back into the body? And the other thing, just I talked about earlier, that where one cell becomes two, the older you are, umbilical cord stem cells, one cell becomes two every about 24 hours, at 24 to 28 hours. When the older you get, over the age of 65, it could take 3 days almost for one cell to become two. So that healing process could almost be doubled, quadrupled, to be able to see the same results or even the same regeneration that you would get from the umbilical cord stem cells. So at the end of the day, I know we both had looked at all of the different stem cell options, and it just made more sense with the patients that we see in our office, is that a lot of them already have issues. They're already sick. They already have chronic illness. It just didn't make sense to me why you would take a sick cell out and try to put it back into somebody. I want young, vibrant, healthy stem cells to give somebody the true optimal healing potential. Doesn't mean that the autologous doesn't work, because it definitely does. I've seen plenty of patients who come in who have had it done, who have seen benefit from it. But at the end of the day, you have to weigh out what are you looking for and what are you already dealing with? If you're below the age of 40 and you just have a joint issue, autologous maybe, and you're wanting, okay with going through the surgery route, that may be a good option for you. But if you're over the age of 40, you have any sort of chronic health issue, let's say you're diabetic, you're autoimmune, that may not be the best option for you, because you're just taking, it's like if you had an old vehicle, an old car, and you took those old car parts out and you put them back in, the car's still not going to run very well. So you really want to be putting these young, vibrant stem cells into the body to get the most out of them, essentially.
Yeah, I would agree with all of that. I think one of those things that we think about with stem cells is all the stem cells can work, right? And I tell patients that all the time. I know many times I have patients come to see me and they went to a seminar and somebody said, well, this person said that only the type of stem cell therapy they do works, nothing else works. And that's not true, because the clinical research is out there. that all the different forms of cell therapy are being used and showing success. But it does really come down to, in many times, the patient. And early on, autologous stem cell therapy was like the thing that was done. And it, 10, 15 years ago, they were doing stem cell therapy on these young athletes, football players and Olympic athletes and MMA fighters. And they're seeing phenomenal results. And the reason for that is if you get a 20-year-old uber athlete, I mean, these are people at the peak of health, and you take out their stem cells and put them back in. Those stem cells are young, youthful, and healthy. But somewhere along the way, it was decided that if this worked really well, taking a 20-year-old stem cells out and putting them back in, and we took a 70-year-old stem cells out and put them back in, that it would work. And we're just not seeing the results. We've seen the clinical research that, the researchers are saying, hey, look, as people get older, stem cells have a great opportunity to reduce these degenerative conditions. The problem is, as somebody gets older, using their own stem cells becomes less effective because the quantity and quality of their stem cells decline. And as you were saying, when we put young stem cells into somebody, they've got 65 potential life cycles in them. If we take your 63-year-old stem cells out of your hip and put them into your knee, some of those stem cells are brand new 63-year-old stem cells. That doesn't mean they're uber healthy, but they're 63-year-old stem cells that are day one 63-year-old stem cells, and they will replicate. And they may get 65 cycles, or maybe because they're already compromised, we're not going to get 65 life cycles out of them. There may be some of those cells may have 20 cycles left, some may have 10 cycles left, and some may be in what we call senescence. And we said that mesenchymal stem cells, these stem cells release anti-inflammatory factors, these young, healthy stem cells. Well, as your stem cells age, and especially as they push into senescence, they actually release inflammatory factors. So they could actually contribute to the degenerative condition or the inflammatory condition because they're dying. Now, why would older stem cells release inflammatory factors? Because as they're starting to die, they want to release inflammatory factors that trigger the body to say, hey, I'm done, I'm damaged, come clean me up and get rid of me. So it's a natural process. But the problem is that, as Dr. Erica said, if you have a problem with your car, do you want to take the old carburetor out and replace it with another old carburetor? Or would you rather take the old carburetor out that doesn't work and put a brand new one in? The brand new one is what most people would argue for because it makes a lot more sense. The other thing is, and it goes back to Dr. Erica's bank analogy, if you're going to put a deposit in the bank, would you prefer to have $2 million or $2 billion, or would you rather $200? When you put your older stem cells in, it's like putting a small deposit in. They don't replicate as fast. We talk about in 30 days, a 60-year-old stem cell really can only become about 200 cells. Whereas if you took a young, youthful, brand new umbilical cord stem cell and put it in the same dish and stimulated it, that one cell can turn into 1 billion cells in 30 days. Which one would you rather have, right? It's a huge difference. So I think that's really cool process. The other thing is that the quantity and quality of your stem cells, we talked that the quantity goes down, but the quality also goes down with time. And so if you are, and I'd say the same thing to my patients, if you're 30, 40, really healthy, you only have like an arthritic knee or a tendonitis, no meds, no health problems, yeah, use your own cells. They'll probably do the job you want it to do and do it effectively. But if you're over 30 or over 40 and you have chronic health issues already, you have chronic inflammatory issues, you have immune or autoimmune conditions, if you have diabetes, if you're taking certain medications, all those things are indications that your stem cell system is already unhealthy. Diabetes and high blood sugar will damage and destroy your stem cells. Statin medications will damage and destroy your stem cells. They'll age your stem cells faster. And if you're not sure if you have a problem, one of the easy things to do, if you just very simply to see the impact that stress and inflammation has on your stem cell system, the easiest way is to look at your hair, right? So stem cells replace hair follicles. And so when you have stress and inflammation in your life, and that's aging your stem cells, your hair follicles are replaced by stem cells. So when you're young and youthful and healthy, your hair comes in, when it falls out, it comes in brown or blonde or black or gray, or not gray, but it comes in one of those colors. But when you're have chronic stress and inflammation and damage to your stem cells, and they're not as healthy, you have a damaged stem cell. It's still replacing the hair follicle, but that hair follicle comes in gray, right? Look at President Obama. When he went into office, he had jet black hair. Stress, inflammation. After 4 years, his hair salt and pepper. He aged himself and his stem cell system. By the time 8 years was done, that guy was pure gray hair. Why? Stress and inflammation, damaging the stem cell system, taking way too many deposits. The stem cell system is still there. It's trying to do its best job, but instead of replacing this brand new black hair, it's in repair mode, and it's really just producing this damaged kind of gray hair follicle, right?
Yeah, and that's a great analogy. And, you know, I see it with even the thyroid patients coming in. A lot of them dye their hair because, you know, they'll say, you know, I went gray in my 20s, but I didn't start developing issues until I was 30, 40 years old. Well, your stem cell system was already starting to show signs of it in your 20s then. And if you don't fix those same underlying things that are making withdrawals from your, you know, bank account, when you get to your 30s and 40s, the symptoms start to compound, and all of a sudden then it's like, okay, I need to figure out what to do. So, you know, when we, you know, since this is a thyroid podcast, you know, when we talk about a thyroid patient coming in to our office, how do you distinguish between somebody who, you know, would be a candidate that you would then refer to your medical team, the nurse practitioner, or the medical doctor for the stem cell therapy, versus somebody who, okay, let's just work on the things that are making withdrawals? How do you draw that line in the sand?
So when I have somebody come in, potentially anybody who's got a chronic inflammatory autoimmune condition is a potential candidate, but everybody's in a different place. And obviously this is not an inexpensive procedure depending on how you look at it, right? So I will look at somebody, and if it's fairly new process, they haven't started it there, and you know, they haven't really done anything yet. They haven't started an anti-inflammatory diet. Their lifestyle factors are really pretty lousy. They haven't been to 5 or 6 practitioners yet, and they failed in all those things. Then I'm probably going to start with the foundational things. Let's start working on foundational issues first. Let's get a good blood chemistry panel done. Let's get you on an anti-inflammatory diet. And for those of you who are just new to the podcast, an anti-inflammatory diet for both Dr. Eric and I is a whole food diet, right? Essentially, Chris Kresser and Joel Kahn are arguing on Joe Rogan the other day. The reality is, the best diet for most people is a whole food, low processed food diet. We keep it that simple. So we really work on people on an anti-inflammatory diet, and then start working on the lifestyle factors. Look at the things, the stressors that are creating the withdrawals from their bank account, right? What are the things that are draining the account? And so we start working on those. If they are a person who's been to multiple physicians, they failed in a bunch of allopathic practices, and they've struggled or failed in a bunch of functional medicine practices, those people weren't bad practitioners. And for the most part, what's going on is this person's got this immune inflammatory, what we call a chronic cell danger response, that's now kind of out of control. And we can utilize those stem cells just to calm the fire. And I tell my patients, listen, the stem cells aren't going to cure every ache and ill that you have. They could, but that's not what really the main focus, what we're trying to do here. We can provide you stem cells. This is like giving you a whole bunch of firemen to try and calm the fire, or we can put a whole bunch of money in your account, right? So now that you don't feel broke, right? And you can pay some bills. But we can't just rely on that, because if you drain that bank account, or that fire continues to rage on, or the firemen come and put the fire out, but then you stand there with a blowtorch and light it back up again, you're going to have your issues back. So I really look at the stem cells for our thyroid and autoimmune and other autoimmune cases as a tool to reduce the immune inflammatory response, get them to really see a quick change in their physiology. So instead of a slower change, we just kind of get some type of a quick impact to start working on knocking down the immune inflammatory response, while we get to work on dealing with the root cause issues, the sleep factors, the breathing issues, the infections, the emotional stress, the physical stressors. So that's how I look at it. But listen, both you and I have helped people recover from chronic thyroid problems for years, and we did it successfully without stem cell therapy. I just think the stem cell is another tool to help us get there a little bit quicker sometimes, a little bit faster, or to really make that process a little bit more comfortable because we're managing the immune inflammatory condition.
I also think that using the stem cells, you know, when patients come in and they've been to multiple doctors and they've never seen results, it's often that, you know, their house is on fire, but there's so much smoke and flame, we don't even know where the fire has started. You know, we don't even have, like, where do you start sometimes with patients because there's so much going on. You know, using the stem cells as a tool to kind of like put the fire out, let's see where the damage really is. And then you can be more fine-tuned with the functional medicine stuff instead of running every single lab test and every single supplement underneath the sun trying to get a response. You can be more targeted because you can really fine-tune it. You know, at the end of the day, if, you know, after using stem cells, if then all of a sudden it's more just, okay, now we need to go on to hormone or adrenal testing, or okay, let's do in some food sensitivity stuff because it seems like we've got more gut issues. I feel like you can be more targeted after using the stem cell therapy.
Yeah, I would agree with that. I mean, it's this. I think we're both touching on the same process. You're not necessarily treating the person's autoimmune condition. Mm-hmm. You're not treating their Hashimoto's. What you're doing is you're just trying to calm the fire, calm that inflammatory cascade, to give you then time to help identify where the primary problems are coming from, and kind of kind of control this process. Because when that chronic inflammation gets out of control, everything becomes compromised. Every system becomes compromised. Thyroid hormone becomes deactivated at the cellular level. We talk about that all the time. So everything hurts. Everything feels bad. Every system is compromised. Not necessarily every system needs to be addressed and treated. What we're trying to do is find out what are the root cause issues. So that gives us time. The patient, we got something in the system to calm the immune inflammatory cascade. And my opinion, and I'm sure it's yours as well, there's, you know, in medicine, they could give them chronic anti-inflammatory use. They could give them immune suppressants if they want. But that is working against the body, not working necessarily with the body. And there's side effects to those things. So this gives us a way to calm the cascade, get the person to kind of, okay, start to feel a little bit better. And then we can fine tune, okay, where do we need to look? What are the primary things that we need to address? And what do we need to address first? And I think that also gives somebody hope. Nothing else has worked. This is a new therapy you haven't done before. This is how nature is designed to heal and repair you on a regular basis. So let's give you back more of what you don't have working well now. And we should start to see some change and improvement. And I've seen a significant change. And I myself, you know, I'm a testament to the therapy. I mean, before we did it, we all flew out to Cincinnati together because before we wanted to bring stem cell therapy to our practice, especially the umbilical cord stem cell therapy, which was way more attractive to us than using the older cells. We wanted to see if they work. And I had injured a knee, and I was struggling with my knee. As an endurance athlete, I had stopped running because it was just too uncomfortable to run. I'd been shifted to riding my bike more. But I have two autoimmune issues, Hashimoto's and Raynaud's. And I had my knee injected. That knee's been fantastic. I haven't had an ounce of discomfort in that knee. And I had that injection done, and 2 weeks later, I drove 4.5 hours down to the Shenandoah Mountains, hiked 4 days with your husband, drove 4.5 hours home, and I haven't had an ounce of discomfort in that knee, and I'm back to running on that knee on a regular basis. So huge benefit there. But I think the more important thing that especially in line with what we're talking about is, you know, I have Raynaud's, and Raynaud's is a condition where when it gets cool or you exert yourself, you lose circulation to your extremities. And it's not a fun thing if you're an outdoorsman, if you're an endurance athlete, or if you're in a hotel room doing a seminar and it's 70 degrees and you'll lose circulation. Your hands go pure white. It doesn't feel comfortable. You lose circulation extremities. I had an IV done when we went out to Cincinnati, and I know you did as well, and I haven't had a Raynaud's episode in over a year. And my thyroid antibodies are next to nothing. So did it cure me? I don't know. I don't really think it cured me. I was doing a lot of things right. And you might say, well, you're talking about autoimmune issues and stem cells, and yet here you are with an autoimmune condition. Absolutely. because I live in a stressed world too. And I do a lot of things right. I eat well, and I exercise, but I do a lot of things wrong too. I mean, I was staying up too late. I was trying to be up late and up early studying and researching and trying to help our patients. I was exercising and pretty heavily, and I was thinking I could exercise at the same level like I was in my 20s and recover the same, and I couldn't. And so I was surprised and shocked when I did my own blood work in my 40s, and not long before we went out to get the stem cell treatment done, and I'm insulin resistant and have positive antibodies. It's like, how could that happen to me? But we're all susceptible to a certain stress load. We all take out deposits on our stem cell system, right? I've had multiple injuries, multiple traumas, lots of different stressors, and I've taken a lot of deposits. I mean, a lot of withdrawals, and wasn't doing as good a job with the deposit end. And so when I got that stem cell in IV done, I didn't walk out of there going, woohoo. I didn't notice the change, like I felt like energetic. But what the most noticeable thing for me was last winter was probably one of the coldest winters we've had around here. And I'm looking at my hands, and usually even in my office, I'd lose circulation. I'm like, man, I haven't had it, and I still haven't had it. And I've been out in the woods, I've been out and exercising, and nothing. So is it a forever thing? I have no idea, but I'll take it. I will tell you that it's made my system healthier.
Oh, that's awesome. I mean, that goes to show you, personal experience. You saw results. I mean, I when we went out there, obviously I had an IV as well. My big thing was I had a history of Lyme disease, and I would have my Lyme. I had done all the natural stuff and the functional medicine, and the Lyme was in dormancy. It wasn't active anymore, but it really had done a toll on my body, especially my nervous system, where I from a car sickness perspective, I literally couldn't get in a car without getting sick, motion sickness, because neurologically it damaged me. I was having weekly migraines, sometimes almost daily migraines. I can tell you about 3 weeks after we got the stem cell injection, I have literally not had a migraine since. And I mean, for me, that's been life-changing, because a lot of them were stress induced, because again, once I got stressed, the inflammation would set in, and then my migraine would set in, and it was like I was done for the day. And we owning our own business, owning our own clinic, being a doctor, we're stressed. It's it's not an easy job at some point. I mean, there's stress involved, and when you just even owning a business is stressful. So that stressed my system and stressed my stem cells. And I mean, I've seen a huge improvement, and seeing that, and what I've seen with a lot of my other patients, whether that's Lyme or just metabolic or autoimmune. I mean, this stuff, it's giving you the resources, but at the end of the day, you still need to be doing all those things to be able to give it an environment to thrive in. And I know me personally, I'm now going to use stem cell therapy as preventative for me, because I know where I was, and I know that, as you age, you're losing the ability to do this. So how frequently am I going to do it? I mean, I probably am going to do it at least once a year for, as long as I can do it, because I want to invest back into that bank account. I want to have enough in that bank account that, I get in a car accident, something happens to me, I have enough resources that aren't going to set me back into this, whether autoimmune spin or whatever it may be. I just want to have enough of the resources there. So, people use stem cell therapy to regain health, but you also can use it to maintain health too. I think that's an important concept, that you can utilize it both ways.
Yeah, we often see people who, there's a big stressor. I mean, they'll have chronic stress, and we talked about this a little bit when we talked about cell danger in the past. And when you're healthy and everything's in balance, we call that homeostasis. What happens to most of us, we have chronic stress. That stress never goes away, and we shift our body from homeostasis to something called allostasis, which means we're still able to function, we're still able to do stuff, but some systems don't work quite as well as others. Like your nervous system, you had repaired but hadn't fully regenerated. And so the nervous system was still functioning, but just not as good as it could have. By taking the stem cells, it helped regenerate some of those neural pathways, which is why a lot of that symptomatology probably improved. But for many people, I think the key is they have a stressor and they get a divorce, they have a car accident, and then their health really deteriorates after that major stressor. And it's probably because they've been in that chronic inflammatory state, but they were in that allostatic state, but they were still managing. And then that last stressor really pushes them into overload, and we see the tissue breakdown. I think if you're making those deposits, right, if you have a higher balance on that stem cell side, the likelihood of that one trigger pushing you into that overload is less likely. And I agree with you. I think we're already seeing it, but we'll see it in the future where people are trying to maintain their youth by diet, lifestyle factors, and stem cell therapy. Because again, you're just giving another deposit back so that the next time you need a withdrawal, your account's not empty. There's still funds in there that you can pull from. The young cells can revitalize your cells. And I think it's the wave of the future of what we're going to be seeing. Instead of doing this kind of allopathic model of managing disease, we're going to have a model where we're trying to really maintain health or a healthier state as long as we can. And stem cell therapy is going to be a huge part of that. So we're getting to the end of an hour here. So we probably want to just kind of wrap this up and just talk about if somebody's interested in stem cell therapy, or how would you give them, what advice would you give them in regards to looking at the different types of stem cell therapy and how to make a decision if it's right or not right for them?
Yeah, I mean, there's many factors that kind of play into it when you're looking at whether you'd be beneficial from it. I mean, I always say assess, are you doing all the necessary things in your life right now, diet, exercise, and you're not happy with where you're at? That would be a good indication that maybe you need something larger deposited into that bank account, essentially. That would be a good candidate. Or somebody who's got autoimmunity, got chronic inflammation, and you want to evaluate that aspect. If you're younger and you're just looking to maintain health and maybe just have a knee, then yeah, maybe going the autologous route is that option. But if you're struggling and you have issues already, then you may want to consider using the younger stem cells, like the umbilical cord stem cells. And more clinics are popping up all over the place. I know we give educational seminars all over the area. So, doing a search in your area and going to maybe one of these free seminars and learning, there's a lot of things you want to look at when you're looking for stem cell therapy. You don't want just some clinic who's just doing stem cells. If there's, because again, that's not addressing that root cause. You want to be looking for somebody who's, in the functional medicine realm that can look at not only giving you those resources, but also can help guide you maybe for the diet, the functional medicine side of it, that you kind of have the full picture as opposed to just doing the stem cells itself. I think that kind of what sets us apart from some of the other clinics out there is that, it's not just stem cells. You do need to work on those things that cause stress and inflammation in the body. That's how people get longer lasting results. I know we both have lots of educational stuff on our websites. We have a whole stem cell presentation for people who don't live in our area, who can't come to a live event to learn about stem cells. And, we've had people travel to our clinic to get stem cells. We've had people from Michigan. We've had people from Florida, Connecticut. We even had a whole family come from the UK to get stem cells in our office. So, people, it's not something you have to come 20, 30 visits. It's one of those things that you can come in. It's usually a one-time, treatment at a time. You may need multiple treatments over a course of 6 months to a year, but in some cases, but most of the time it's a one visit treatment where people can travel, come in, get the stem cell therapy, and then go right back. So, it's one of those things that, you can find a local clinic, but you also can travel to a clinic that you feel comfortable with.
Yeah. I think the key is to do some education. There's a lot of information and there's a lot of misinformation that's available on the web. I think you got to be careful. I think the people who are telling you that the only stem cell therapy that works is the one they do, and that they are the only ones that really know how this whole process works, I think you need to be cautious of those types of people. I think if you're talking to somebody like Dr. Erica or myself, who is upfront and honest and says, listen, all options have the potential to work. We've just chosen to use the umbilical cord cells from blood or the Wharton's jelly because they're the most youthful cells. They replicate the fastest, and they have the healthiest, what we call the secretome, the excretions from those. And so it's less expensive typically than doing autologous. So we've chosen that, but they all have the potential to work. So if somebody's telling you that only what they do works, that they're really the only person that knows how to do this process, that's one of those things to be wary of. And I think the other thing that Dr. Erica said, which is really important, is remember that the stem cells are not going to cure your condition, right? The stem cells are anti-inflammatory, immune modulating, and they're regenerative. Could you get stem cell therapy like me, and your Raynaud's issue goes away, or your autoimmune condition calms down? Absolutely, that can happen. But if somebody's holding out that, hey, we're going to cure your condition with stem cells, be cautious, be careful, and consider the fact that stem cells are there anti-inflammatory, immune modulatory, and regenerative. And it's part of it's really like giving you a bigger deposit into your account, but you really want to work with somebody who's going to help you with the rest of the piece. What are the stressors? What are the lifestyle issues? What are the things that are actually creating the withdrawals? Because if you don't figure out what are the things that are stealing and aging your stem cell system, the stem cells that we provide you aren't going to be in your account very long, and you're going to be back to where you were. And we want you, both of us want you to have, if you're going to use stem cell therapy, we want you to have a long-term benefit. As Dr. Erica said, one treatment may do well for a ton of people. But could you need another treatment down the line? Absolutely. If your withdrawal system is greater than your deposit system, yeah, you may need another stem cell treatment down the line. I had my knee done. Could I use another one somewhere in time? I might. Is that knee going to be perfect forever? Probably not. I do a lot of dumb stuff. I could re-injure my knee. I may do it this weekend in the woods. And if I do, because I had stem cells in that knee and my overall stem cell system is potentially healthier, could it heal on its own? Absolutely. But could it get injured? I have another meniscal tear and I have some issues with that knee. Absolutely. Does that mean the stem cells I had done a year ago didn't work? No, they did their job. I had a new injury. I may need another treatment, right? And so I think sometimes I talked to a lady, I alluded to this earlier. She had stem cell treatment 5 years ago, and she fell and injured her knee and said, I don't think it worked. No, it worked. It did its job. You had a new injury, a new trauma, but you're 5 years older. Your stem cells are 5 years older, and they weren't able to heal and repair that tissue the way they may have done it if you were 5 or 10 years younger. So go get another treatment done. It's probably the best thing to do. That's what I would consider. If my Raynaud's comes back or my Hashimoto's antibodies flare, I'm going to do two things. I'm going to look at my diet, my lifestyle. I'm going to check out what's going on. What are my stressors that are creating withdrawals? And then I'm going to probably go back and say, time for another treatment of stem cells to calm this immune inflammatory cascade while I try and figure out and deal with the stressors that are creating with the withdrawals, right? So I say we wrap this baby up. As always, it's a pleasure doing podcasts. We will try and shoot for maybe next week or the following week, get another podcast out, maybe do another listener Q&A. So if you have questions regarding stem cell therapy, I know I've got a ton of people reaching out to me on YouTube with lots of questions. I want to cover a bunch of those. I want to talk, I just did a Thyroid Thursday patient. We did stem cell therapy on. Really nice changes in treatment, but we hit a plateau. And I think it's good to talk about how some of your medications can compromise your thyroid physiology. So I'll talk about how HER2 blood pressure medications are inhibiting thyroid hormone production of thyroid hormones, but making her TSH look low, like she doesn't have a thyroid problem. So I think we can talk about that on another podcast. I think that'd be really important to do to help people understand that the medications you're taking many times can inhibit and compromise thyroid physiology and be a root cause of your problems. So let everybody know where they can find you, Dr. Erica.
We have a website. We have Facebook, where you can find us at Brain and Body Health Center. And then you can also find us at our website at brainandbodyhealthcenter.com. There's lots of information on there, how to contact our office, presentations, videos, all of that.
So yeah, these guys do a great job from an educational standpoint. My office was Chronic Condition Recovery Center and Chronic Condition Regenerative Center. We've combined those two offices, and we're now operating under Rejuvigen. And our website is rejuvigencenter.com, but you can find us at Rejuvigen on Facebook, and you can either find me on Dr. Balcavage on YouTube and Vimeo, Thyroid Problems Doctor. You can find Thyroid Thursday videos on YouTube and Vimeo, and you'll probably see more stuff coming out. I am in the process. I've said this many times. I'm working on the book, but this time I am fully committed. I don't have any lecture commitments in the next 6 months, and I'm fully committed to get a new thyroid book out there that's going to kind of blow the thought process of most of these thyroid books and how we look at thyroid physiology out of the water. It's more in line with what you and I talk about all the time. It's a cellular thing first in most cases, not a glandular thing first. So look forward to that. So we're going to sign off. Thanks everybody for listening in. If you love this podcast or enjoy the information you get, please go to iTunes. Give us a rating there. 5's awesome, I think, is what the good one is. Tell your friends, tell your family, post this on Facebook, and we'll continue to grow and help more people. All right. Thanks everybody. Take care. Dr. Erica, have a great day. Okay.
You too.
All right.